So, good day ma'am, I'm Louise Daniella, and today I'm going to do the initiating, maintaining, and terminating blood transfusion. So, first is assess the clinical signs of reaction, manifestations of hypervolemia, status of infusion rate, any unusual sign, vital signs for baseline data. Next is determine that a signed consent form was obtained, any known allergies or previous adverse reaction to blood. So next is assemble equipment, the blood product, blood transfusion set, normal saline for infusion, the IV pole, benepuncture set containing the 18 or 19 gauge needle, and chlorhexidine solution, alcohol swabs, and tape and clean gloves. So next is prepare the client, introduce yourself, and verify the client's identity. Explain the procedure and its purpose to the client. Instruct the client of any sudden chills, nausea, itching, rash, dyspnea, back pain, or any other unusual symptoms. If the client has an intravenous solution infusing, check whether needle and solution are appropriate to administer blood. So next is set up the infusion equipment. Ensure that the blood filter inside the drip chamber is suitable for whole blood or the blood components to be transfused. Attach the blood tubing to the blood filter if necessary. Next, and then put gloves. Close all the clamps on the Y-set, the main flow rate clamp and both Y-line clamp. Using a twisting motion, insert the piercing or spike into the container of saline solution. Into a 1 meter or 3 feet above the planned venipuncture site. So, prime the tubing, open the upper clamp on the normal saline tubing, and squeeze the drip chamber until it covers the filter and 1/3 of the drip chamber. Tap the chamber to expel any residual air in the filter. Remove adapter cover at the tip of the blood administration set. Open the flow rate clamp and prime the tubing with saline. And close the clamp. Start the saline solution. If an IV is incompatible with blood is infusing, stop the infusion and discard the solution and tubing according to agency policy. Attach the blood tubing prime with normal saline to the IV catheter. Open the saline and main flow rate clamps and adjust the flow rate. Use only the main flow rate clamp to adjust the rate. Allow a small amount of infuse to make sure there are no problems with the flow or with the venipuncture site. Next is prepare the blood bag. Invert the blood bag gently several times to mix the cells with plasma. Expose the part of the blood bag by pulling back the tabs. Insert the remaining Y-set into the blood bag. Suspend the blood bag. Next is open the clamp. Establish the blood transfusion. The blood will run into the saline-filled drip chamber. If necessary, squeeze the drip chamber to establish the liquid level with drip chamber 1/3 full. And readjust the flow rate with the main clamp. Readjust the flow rate with the main clamp. Next is terminate the transfusion. Put on clean gloves. If no transfusion to follow, clamp the blood tubing and remove the needle. If another transfusion is to follow, clamp the blood tubing and open the saline infusion arm. If the primary IV is to be continued, flush the maintenance line with the saline solution. Disconnect the blood tubing system and re-establish the intravenous. To be continued, flush the maintenance line with saline solution. Disconnect the blood tubing system and establish the intravenous infusion using new tubing. Adjust the trip to the desired rate. Discard the administration set according to agency policy. Needles should be placed in a labeled puncture-resistant container designed for such disposal. Blood bags and administration sets should be bagged and labeled before being sent for decontamination and processing. Next is remove the gloves and monitor vital signs. Document relevant data. Record completion of the transfusion, the amount of blood, the blood unit number, vital signs. If the primary intravenous infusion was continued, record connecting it. Also record the transfusion on the IV flow sheet and intake and output record.